Couple of weeks, we've talked about the struggle by doctors and nurses to get enough PPE, or personal protective equipment. Tonight, we're talking with Dr. Patrick Kenney from Yale New Haven Health System about a system they've developed to reprocess masks and to make them reusable. Doctor, first of all, thanks for joining us tonight.
Thank you, Dennis.
We're hearing stories about people having to use the same mask for several days in a row. What are you doing to make them sterile again?
We've established a process here where we're sterilizing respirators with vaporized hydrogen peroxide, like the hydrogen peroxide people use at home.
What exactly, I know a lot of people want to know, we're learning a lot about masks, much more than we ever thought we had to, but what is an N95 mask and how is it different from another mask?
So an N95 is something called a respirator. And what that is a mask that fits over the nose and the mouth, and it's intended to filter the air that the wearer is breathing. That's different than a surgical mask or other masks you see people wear, which are really fluid barriers. And those are intended to prevent droplets from getting access to the mouth or nose.
Where do you clean these masks and how are you able to do it?
So what we're doing is we've established a recycling program, a lot like what everyone does at home. And at the end of the shift, our staff are putting the N95 respirators in a bag, and those get brought down to a central area. They go into a room that has racks in it. They get suspended by their elastics in the rack. The whole room gets filled by a machine with vaporized hydrogen peroxide. It takes 5 or 6 hours. And we were able to demonstrate that that process is virucidal, meaning it kills a virus.
And how many masks are you able to do?
We're estimating in the range of 15 to 16,000 per day when we're at our peak.
Is this only happening at Yale, or are you cleaning the masks from other hospitals as well?
Right now, we're handling the volume from Yale, but there are other groups working on this. There's a company in Ohio that just received FDA clearance for the same process.
You know, every day we hear something new about the coronavirus, and here's a question for you. There's some thought out there that UV light could kill the virus. Is there any truth to that at all?
There is, and in fact, people have investigated UV light for sterilizing respirators. The University of Nebraska Medical Center has issued their protocol, and there are good data to support it.
Dr. Patrick Kenney from Yale New Haven Health, we appreciate you joining us tonight.
Thank you so much, Dennis.
Stay safe.